right. Well, welcome to our first LinkedIn Live session, which is very exciting. And today we are tackling the topic of interviewing internationally educated nurses. Today we have Chandler, who is one of PRS Global's client service managers, and Paul, who is an internationally educated nurse who was very successful with an interview and has a position in the United States and is currently going through the immigration process, which is very exciting. And Chandler's really known for facilitating these successful onboarding interviews with between internationally educated healthcare professionals and US-based hospital systems or skilled nursing facilities, and just has a really great way of bridging, has seen many interviews. So if you want somebody who can really share with you what different hospitals are doing and some of the best interviews he has seen. So we're excited to have you, Chandler. And Paul is going to be able to share the perspective of just his experience and what he found really helpful when he was doing the interview and ultimately helped him choose to go with that hospital. And so together, they're going to share some best practices. And with that, I'm going to hand it over to you. Chandler, you want to kick this off?
Yeah, absolutely. And excited to be on this platform with you guys. I think that we've identified really three key practices that clients that have had the most success with international applicants that we've found. At first, I would say would be the discovery. So best practice would be to discover about the applicant, right? Like these are asking the 4 W's of who they are as a working professional. When did they decide to become a nurse? Why did they decide to become a nurse? And what their long-term goals are. I think that discovery process, PRS is going to be doing our due diligence of presenting qualified applicants. And now it's just making sure that they're going to be a good fit for the organization. I think, Paul, you said earlier before we hopped on that you had some questions that a nurse manager might ask that really helped you out.
Yeah. Uh, I think the question "Tell me about yourself" is very important to be asked on the first as the first question, as the initial question, because applicants is a bit nervous for the first 5 minutes of the interview process. So at least it's more personal question rather than jumping to your job, your experience, and so on and so forth. So at least this personal question will give an elbow space for the applicants to gather his thoughts and uh, manage his emotion, and it really helped the applicant to relax uh, answering those questions. So I think that is a very good question. And also the question, what are your priorities? So that is a very good question also to be asked to the applicants. At least the priorities of that person, and that's discovering who you're hiring, right?
That's great, and it's really a way to connect at the beginning. But I love how you're just sharing with managers out there that are interviewing internationally educated nurses. It's nerve-wracking, right? And because you're not just interviewing for a new job at a new hospital, you're interviewing for coming to a new country. And so I love, Paul, that you shared that tidbit that just asking, tell me a little bit about yourself helps to kind of take down those nerves and helps you be really present during that interview. That was great.
Yeah, I would say the second best practice is to make sure that you're engaging, right? Be enthusiastic about this opportunity that you've got. So, I mean, your excitement that you're going to be portraying to the applicant, based off of your demeanor and how you're interacting with them, is really going to sell that work environment and see that they're going to be stepping into an opportunity that's not just for the short term, but it's a long-term career option. So I would say being engaging also helps settle those nerves that Paul mentioned. And Paul, it sounded like you had a pretty good experience whenever you had your client interview. Is that right?
Yeah, yeah, I did. I remember during my interview, the manager smiled at me. He called me by my first name, and then he asked question. He asked me how am I. So this really helped me to engage with that manager. So I think that's a good practice.
I love that. So just a simple smile and using your first name really helped you feel connected. So it's important with who the manager is that's going to interview you, right? Like that, just taking that extra time to find people who can really connect makes a difference.
Yeah, it's definitely just like even just something as simple as, hey, make sure your video camera's on. Make sure that you've got good lighting and that you're not doing a million other things, and that there's a portrayal that like your attention is solely on what's happening in this interview process. So that type of engagement is really going to yield the best result for sure.
Yeah. And Chandler, I remember you telling me one time that when managers are all in the same room and they're at a table and they're further away, you've noticed that it's not as easy to connect with the healthcare professionals. So having the Zoom and having each face right there is is a little bit easier to connect.
Right. Yeah, absolutely. Yeah. Make sure that it's not just one big group because audio issues and things like that from a technical standpoint. But also too, maybe there's some of those folks who are behind the scenes in the hiring process, but maybe they're not going to be the person who's really making the decision. So making sure that you limit it to the people that need to be on the call, and then having your own individual logins, that just gives a little bit more of a personal touch to it.
Yeah, that's great. Thank you for that.
Certainly. Yeah. And I would say our third best practice is to inform. So you're 10 minutes into an interview, right? You've gotten to know Paul, the nurse, and you're like, oh my goodness, like he's amazing. We'd love to have him. If we could have him tomorrow, like we would do it. Make sure that once you've kind of identified that in the middle of the process, this is an opportunity to begin informing the candidate about all of the things that make the facility great. Perhaps it's the benefits, it's the career ladder, it's the work environment that they have. And maybe it's something as simple as just talking about the parks and the neighborhoods and all of the fun things to do in the community. Because a lot of people that are going to be coming, they're going to be coming not just by themselves, they'll be coming with families. And so they want to know things about like the school systems, safety, the cost of living, things like that. So it's going to be an opportunity for you to paint the picture, to show them like, hey, this is how it would look for you to live in our community, to work in our facility, but also to make a broader impact within the community as a whole. So, Paul, I can just say as somebody that hasn't had to make this experience or to make this jump, probably being informed about all of those things is going to put you at ease and help you make an informed decision. And I would say some of those things about, Paul, what would you say, as somebody who hasn't been to the United States, what were some of the things that they shared with you that helped you say, okay, I think this is going to be the best fit for me and my family?
Well, the manager told me the opportunities that the U.S. can give to my family, to my wife, who is also a nurse, the free education for my kids. So actually, those are my priorities. So when I heard them from the manager, I said to myself, okay, this is the uh, country that I want to grow old. At least, you know, I will have a better life because I'm here in Saudi Arabia, and one of my concern is, I'm working far from my family, and US is the country which will give me the opportunity to work at the same time to be with them. So I think that's the breaking point of choosing America. Aside from the fact that nurses receive a good salary
Yeah, that's great. And Paul, I didn't even think of that part, but right now you're working in another country and your family isn't there with you. So that was really important to you for the manager to be sharing about the schools and a little bit more than typically we share in the United States when we're having these interviews. So that's great that you shared, just adding a little bit more information on beyond just the hospital. So that's great. Paul, anything else that either when you interviewed for the university hospital, something that they did that really made the interview fantastic, or any other recommendations that you have for managers who are going to be interviewing internationally educated nurses?
Perhaps they can give a promotional videos of the healthcare facility to the applicants. That will really help us, because there is a waiting time before you are being interviewed, so we can maximize that time by sharing a video of the healthcare facility. At least before the interview, the applicant has an idea. Okay, this is the hospital. I can relate with the hospital because I have some information about that hospital. So I think if they have some video clips about the hospital, show it to the applicant.
That's great. I love that, Paul. That's great advice. And we do have some clients that even put together a video to welcome those that they're going to be interviewing. And it really does make a difference. I think that's great advice for a best practice. Chandler, anything else that you see in those healthcare or hospital systems that have a better conversion, and any tips that you have that you see that are really best practices?
And I think it really kind of boils down to the common phrase, you get what you put in, right? So if you're putting forth your best foot and you're making an investment from everything from how you present yourself on the interview process all the way to how you greet them at the airport or welcoming them when they arrive, that's what you're going to get out of this, right? So some things that you can do, like Paul had just mentioned, like leverage your marketing collateral to really paint the picture prior to that interview happening. So that way, when a nurse like Paul gets to step foot virtually in an interview, they're going to be able to know exactly what they're getting into, and they'll be able to even do a self-assessment to make sure that they're qualified and they see themselves working in that institution. So, really just put your best foot forward. Make sure that everybody that's going to be interacting with these nurses, whether you're in a senior leadership position all the way down to the hiring manager that will be working and training them, and make sure that everybody's well aware of this program that's going on and how it's going to, just drastically impact culture, positivity, all those different things. So that's what I would share. To make sure that you're putting your best foot forward.
Yeah, I love that, Chandler, because there's a lot of those touch points along the journey that the client has and that the healthcare professional, nurses or med techs have as well. And it all starts with that interview.
It does.
So, well, I had such a great time. I learned some things. And Chandler, as always, thank you for everything that you do. And thanks for being on today to share some best practices that you see from many different hospital systems. And Paul, thank you so much for just taking the time to give us a perspective from a nurse who went through an interview on some things that really made a difference and some recommendations. Those were fantastic. So I appreciate you both. Thank you all for joining, and we'll see you next time.